What if I told you that long before there were pharmacies on every corner, long before there were white pills in orange bottles, long before doctors had to write a prescription just to help you manage pain, there were plants that grew in meadows and forests, along roadsides and riverbanks. Plants that grandmothers knew by heart. Plants that soldiers packed into their saddlebags before riding into battle. Plants that midwives, healers, and herbalists used to guide people through pain, whether it was the burning ache of arthritis, the stabbing throb of a toothache, the slow grinding misery of chronic inflammation for thousands of years. Most people today don't know this, and that's not an accident. When pharmaceutical companies began patenting synthetic compounds in the 20th century, something quietly disappeared. Not the plants themselves. The plants are still there, still growing, still working exactly the way they always have. What disappeared was the knowledge, the handed-down wisdom, the grandmother who knew which leaf to steep, which root to simmer, which flower to press into a sack. That knowledge didn't vanish. It was buried, slowly, steadily, under the weight of convenience, marketing, and a medical system that profits from dependency rather than healing. But nature doesn't forget, and neither do we. Today, we're bringing 20 of those forgotten plants back into the light. 20 natural painkillers, backed by centuries of traditional use and in many cases, validated by modern clinical research that rivaled and in some ways surpass what you'll find behind a pharmacy counter. Number 1, white willow bark Salix alba. The original aspirin tree, long before aspirin existed as a white tablet in a foil blister pack, there was the willow tree. Picture it, a riverbank in ancient Egypt nearly 4,000 years ago. A healer reaches for the bark of a willow tree, peels it carefully, boils it in water, and offers the brew to a patient burning with fever, aching with pain. That moment is documented in one of the oldest medical texts in human history. The Hippocrates himself, the father of Western medicine, prescribed willow bark tea for pain and fever in ancient Greece. Native American tribes across North America chewed willow bark for headaches and joint pain. Medieval European herbalists kept it in their apothecaries for everything from toothaches to rheumatism. Then, in 1897, a chemist at Bayer isolated the active compound salicin and synthesized a modified version of it. They called it acetylsalicylic acid. We call it aspirin, and in doing so, they patented what nature had offered freely for 4,000 years. Here's what they didn't tell you. Willow bark contains a complex matrix of compounds alongside salicin flavonoids, polyphenols, and other substances that work synergistically to reduce pain and inflammation without the stomach-irritating effects that synthetic aspirin can cause. Clinical studies, including a double-blind trial published in the journal Rheumatology, have shown that willow bark extract is effective for chronic lower back pain and osteoarthritis, often with fewer side effects than conventional NSA. How to use it at home? Simmer 1 to 2 teaspoons of dried willow bark in 2 cups of water for 20 minutes. Strain. Number 3. Boswellia serrata, the sacred resin of 5,000 years. You know it as frankincense, one of the 3 gifts brought to Bethlehem, but long before it was a symbol of reverence, it was medicine. The most sophisticated pain medicine available in the ancient world. Boswellia trees grow in dry, rocky terrain across India, East Africa, and the Arabian Peninsula. They are tapped like maple trees. Their bark is cut, and the milky resin that seeps out is collected and dried into the fragrant, amber-colored tears we call frankincense. In Ayurvedic medicine, this resin has been used for rheumatic conditions, inflammatory diseases, and joint pain for at least 5,000 years. Modern pharmacology has identified why. Boswellia resin contains compounds called boswellic acids that inhibit an enzyme called 5-lip. Unlike conventional anti-inflammatory drugs which often damage the stomach lining and strain the kidneys with long-term use, boswellic acids target inflammation without these gastrointestinal side effects. Clinical trials have demonstrated significant benefits for osteoarthritis, particularly of the knee, as well as for inflammatory bowel disease, rheumatoid arthritis, and asthma. One particularly compelling 2003 study published in Phytomedicine found that patients with knee osteoarthritis who took Boswellia extract for 8 weeks experienced significant reductions in pain and swelling and increased walking distance results that held up in follow-up studies. How to use it at home. Boswellia extract capsules, standardized to contain at least 60% boswellic acids, are the most reliable form. A typical dose is 300 to 500 milligrams. Number 5. Ginger zingiber officinale. the route that warms from the inside walk into any traditional herbalist's practice in China, India, Japan, or the Caribbean, and you will find ginger. It has been used medicinally for over 5,000 years, making it one of the oldest documented herbal medicines in human history. Ancient physicians called it the universal medicine, and they used it for pain in ways that would feel entirely familiar today, rubbing fresh ginger on aching joints, brewing it for muscle pain after labor, drinking it to calm the burning pain of digestive inflammation. The compounds in ginger and pyridols inhibit the same inflammatory enzymes as conventional anise, including SOX1 and SOX2. A landmark 2015 clinical trial published in Osteoarthritis and Cartilage demonstrated that ginger extract significantly reduced pain and disability in patients with knee osteoarthritis. Another study found it as effective as ibuprofen for menstrual pain. For post-exercise muscle soreness, research has shown that daily ginger consumption reduces pain intensity significantly within 24 hours. How to use it at home. Fresh ginger tea. Slice a 2-inch piece of fresh ginger root, simmer in 3 cups of water for 15 to 20 minutes. Strain, add honey and lemon. Drink 2 to 3 cups daily for chronic pain. For topical relief of joint or muscle pain, make a ginger compress. Steep grated fresh ginger in hot water. Soak a cloth in the strained liquid and apply to the painful area for 20 minutes. Ginger turmeric capsules combining both routes in standardized form are also widely available. Safety note, may thin blood in very high doses. Safe for most people in culinary and moderate medicinal amounts. Some people experience heartburn with large doses. If there is one root that belongs in every kitchen and every medicine cabinet, it is this one. Number 6. Clove. Syzygium aromaticum, nature's most powerful local anesthetic. There is a compound called It is found in the highest concentration in clove buds, and it is one of the most potent natural analgesics, meaning pain blockers, that nature has ever produced. Dentists know this. Eugenol is still used in dentistry today as a local anesthetic, a pulp capping agent, and an emergency dental cement. Long before dental offices existed, people across Asia, the Middle East, and later Europe were doing exactly what modern dentistry does, pressing whole cloves against aching teeth, packing clove powder into cavities, rubbing clove oil on gums. And it worked. Traditional Chinese medicine has used cloves for toothache, headache, and joint pain for over 2,000. Number 7. Manos California, Poppy Ischiozesia californica, the gentle nerve soother. Before you hear the word poppy and feel a flicker of alarm, let me be very clear about something. California poppy is not opium poppy. It does not contain morphine or codeine. It does not cause addiction. It is the state flower of California, perfectly legal everywhere, and it has been used by Native American tribes for centuries as one of the gentlest and most effective plants for nerve pain, anxiety, and sleeplessness. The Costanoan people of California used California poppy as a sedative and pain reliever. The Mendocino people applied it topically for toothache. Indigenous healers throughout the American West brewed it into teas for headaches and nervous tension. What California poppy contains are compounds called alkaloids, including California D, protapine, and allocryptopine that interact with the nervous system's GABA receptors. The same receptors targeted by some sedative medications, but in a much gentler, non-habit-forming way. Modern research has demonstrated anxiolytic, anti-anxiety, antispasmodic, and mild analgesic effects. It is particularly valued by herbalists today for nerve pain, tension, headaches, insomnia related to pain, and the kind of restless, anxious aching that makes sleep impossible. How to use it at home? Steep 1 to 2 teaspoons of dried California poppy, aerial parts leaves, flowers, and if available, roots in boiling water for 15 minutes. Drink 1 cup in the evening for pain-related insomnia or nerve pain. For daytime use, half a cup will provide gentle relief without sedation. California poppy tincture is also widely available and effective. For tension headaches, combine with lemon balm and skullcap in a tea blend. Number 9. Meadowsweet Filipendula ulmaria. The original aspirin. Here is a piece of history that was quietly buried the moment it became inconvenient. In the 1800s, a German chemist named Felix Hoffmann was working to synthesize a compound derived from willow bark. In that process, he actually worked with extracts from meadowsweet, a beautiful, cream-flowered plant that grows along streams and wet meadows across Europe and Western Asia. The plant's old scientific name was spirea, which is where the spear in aspirin comes from. But here's what Bayer's patent didn't capture. Meadowsweet contains not just salicylates for pain relief, but also tannins, flavonoids, and mucilaginous compounds that protect the stomach lining, the very lining that synthetic aspirin can damage and irritate. Traditional European herbalists use meadowsweet for stomach ulcers and gastric pain, for headaches and fevers, for rheumatic joints and muscle aches. They were treating pain while simultaneously protecting the very organs that aspirin damages. This is the genius that pharmaceutical syntheses discarded, not the active molecule, but the whole plant, the intelligence of nature's formulation. Number 11. Comfrey symphytum officinale, the bone knitter. Comfrey's folk name tells you everything Konichivoni. Bruisavarchi, healing, herb. The names accumulated over centuries of experience, each one pointing to the same truth. This plant speeds the healing of damaged tissue in ways that nothing else quite replicates. Medieval herbalists applied comfrey root poultices to broken bones, believing they could feel the tissue knitting back together. They weren't wrong. The root contains high concentrations of allantoin, a compound that stimulates cell proliferation, literally encouraging cells to multiply and repair damaged tissue faster than they would on their own. It also contains rosmarinic acid, a powerful anti-inflammatory, and mucilaginous compounds that soothe irritated tissue. Multiple modern clinical trials have confirmed what folk medicine knew. A 2004 study published in Phytomedicine found that comfrey root extract gel significantly outperformed diclofenac gel, a pharmaceutical anti-inflammatory for ankle sprains. Studies have shown benefits for back pain, osteoarthritis, bruising, muscle soreness, and surgical wound healing. How to use it at home. Comfrey salve is one of the most practical medicines you can make at home. Infuse dried comfrey root in warm olive or coconut oil for 6 weeks, or use a slow cooker set to its lowest setting for 8 hours as a faster alternative. Strain. Melt beeswax into the strained oil at a ratio of roughly 1 ounce of beeswax per cup of oil. Pour into tins or glass jars and allow to set. Apply to sprains, bruises, sore muscles, and painful joints up to 3 times daily. A simple comfrey poultice, fresh or rehydrated dried leaves applied directly to the skin and wrapped with a cloth is traditional for fractures and major bruising. Safety note: for external use only. Comfrey contains pyrrolizidine alkaloids that can cause liver damage if ingested. Do not apply to deep wounds or broken skin, as rapid surface healing over a deep wound can trap infection. Do not use internally. This is the plant that makes bruises disappear faster than you think possible, and does it by speaking the body's own language. Number 12. Valerian root. Valeriana officinalis, the ancient muscle relaxant. Long before muscle relaxant medications existed, there was valerian root. And long before it was marketed as a sleep aid, it was known primarily as something else. Number 13. Capsaicin peppers. Capsicum annuum, Capsicum frutescens, the burning cure. This is perhaps the most counterintuitive entry on our list. Something that causes burning pain relieves it. Yet this is exactly what generations of traditional healers knew, from the indigenous peoples of the Americas who first cultivated these plants, to Ayurvedic practitioners in India, to Caribbean folk healers who applied hot pepper preparations to arthritic joints and painful muscles. And modern neuroscience has given us a precise explanation for why. Capsaicin, the compound that makes peppers hot, activates pain receptors in the skin called TRPV1 receptors. Initially, this causes that familiar burning sensation. But with repeated exposure, those receptors become desensitized and depleted of a pain-transmitting neurotransmitter called substance P. The result? The area becomes significantly less sensitive to pain. The burning paradoxically creates numbness. Pharmaceutical companies have capitalized on this in the form of capsaicin patches and creams. But the traditional knowledge predates these products by centuries. Cayenne pepper liniment was used by herbalists for arthritis, joint pain, muscle pain, and even the nerve pain of shingles. Current evidence supports capsaicin's use for osteoarthritis, neuropathic pain, postherpetic neuritis, and chronic musculoskeletal pain. How to use it at home? Cayenne pepper liniment. Mix 1 teaspoon of cayenne pepper powder into 1 cup of warm coconut or olive oil. Apply a small amount to painful joints or muscles using gloved hands. Do not touch your face. Leave on for 20 to 30 minutes, then wash off. The burning sensation is initially strong but fades within minutes. Repeat twice daily. With consistent use over 1 to 2 weeks, significant pain reduction typically occurs. Pre-made capsaicin creams containing 0.025% to 0.075% capsaicin are also available and effective. Safety note: always wear gloves when handling. Avoid contact with eyes, face, and mucous membranes. Keep away from children. Do not apply to broken skin. The first applications will be hot. This is normal and diminishes with continued use. The indigenous peoples of the Americas gave the world medicine in the form of fire. And the fire, used wisely, takes pain away. Number 14. Passion flower passiflora incarnata, the nervous system's gentle guardian. There is a vine that grows wild across the southeastern United States, climbing fences and draping over roadsides, producing flowers so intricate and otherworldly that Spanish missionaries in the 16th century saw in them symbols of the Passion of Christ. The Cherokee people saw in them medicine. Passion flower was used by Native American tribes, including the Cherokee, Homa, and Algonquin, for anxiety, nervousness, insomnia, and pain, particularly the kind of pain that works. Number 15. Feverfew tenacitum parthenium, the migraine preventer. If there is one plant that deserves to be in every home where someone suffers from migraines, it is fever. This small, daisy-like herb with feathery, pungent-smelling leaves has been used in European folk medicine for centuries, primarily for headaches, fevers, and aches of the womb. The name itself comes from its traditional use as a febrifuge, a fever reducer. But it was for migraine headache that feverfew became truly remarkable in the 20th century. The story begins in Wales in the 1970s, when a physician's wife began eating fresh feverfew leaves daily and found her decades-long migraines dramatically reduced. Her husband investigated and published preliminary findings that sparked a wave of clinical research. Multiple randomized controlled trials followed. The evidence accumulated. Feverfew reduces the frequency of migraine attacks. It may reduce their severity. The mechanism involves parthenolide, a compound that inhibits platelet aggregation and prevents the release of prostaglandins and serotonin processes involved in triggering migraines. Traditional herbalists also used it for arthritis pain, menstrual cramps, and inflammatory conditions. The anti-inflammatory properties are real and broad, but for migraine prevention specifically, feverfew's clinical record is remarkable. How to use it at home? For migraine prevention, the traditional method is to eat 2 to 3 fresh leaves daily in a sandwich or with food. The leaves are intensely bitter and should not be chewed directly, as they can cause mouth ulcers in some people. Dried leaf capsules are a more palatable alternative. Look for preparations standardized to 0.2% taken daily as prevention rather than for acute attacks. Feverfew tincture can also be taken daily. Note: feverfew works as prevention, not for acute migraine relief. It needs to be taken consistently over weeks and months. Safety note: do not stop taking feverfew suddenly. Rebound headaches can occur. Avoid during pregnancy may increase bleeding time. Some people develop mouth ulcers with direct leaf contact. A gardener's wife stumbled onto what medieval herbalists had always known. Some remedies just need to be rediscovered. Number 16. Skullcap Piscutelaria lateriflora, the forgotten nerve tonic of the deep in the hollows of Appalachia. In the old healing traditions of mountain midwives and root doctors, skullcap was known as one of the most reliable herbs for pain that lived in the nervous system. The headaches that wouldn't break, the nerve aches that kept people awake, the tension that settled into the base of the skull like a stone. Skullcap is native to North America, and it was the indigenous peoples of the continent who first understood its medicine. The Cherokee used it in ceremonial healing and for nervous complaints. American eclectic physicians of the 19th century, who combined botanical medicine with conventional practice, considered it one of their most important Nervian herbs, a plant that genuinely quieted and restored an exhausted, overwrought nervous system. The plant contains bacolin and scuteolarian flavonoids that bind to GABA receptors and have demonstrated genuine antispasmodic and mild analgesic effects in modern research for the pain that is inseparable from nervous tension, the tight, throbbing, pressure-built headache, the ache behind the eyes, the neck that locks in spasm under stress. Skullcap addresses the source rather than just numbing the signal. How to use it at home? Use fresh or recently dried skullcap herb, as the active compounds degrade relatively quickly. Steep 1 to 2 teaspoons of dried herb in boiling water for 10 minutes. Drink 1 cup as needed for tension, headaches, or nerve pain, up to 3 cups daily. Skullcap tincture made from fresh plant is considered more potent than dried preparations. For headache, combine skullcap with feverfew for migraine type or with passion flower for tension type for a synergistic herbal headache formula. Safety note: generally well tolerated. Mild sedation possible. Avoid during pregnancy. Some concern exists about adulteration in the commercial supply, sourced from a reputable herbalist or grow your own. The mountain healers of Appalachia held on to this knowledge when the rest of the world forgot. We are grateful they did. Number 17. Black Cohosh Actea reyesmosa, the women's pain plant. Deep in the forests of eastern North America, beneath the canopy of oak and maple, a tall plant with creamy white flower spikes grows in rich, shaded soil. Native American women knew it well. The Algonquin, Cherokee, Iroquois, and many other nations used the root of black cohosh for menstrual pain, the pain of childbirth, and the muscle aches and joint pains that accompanied what they recognized as the transition of midlife. European settlers, observing its use among native healers, brought it into their own practice. By the 19th century, it was one of the most widely used herbs in American eclectic medicine, prescribed by physicians for rheumatism, neuralgia, and women's pain. It was included in the United States Pharmacopoeia from 1820 to 1926, an official recognition of its status as legitimate medicine. Black cohosh contains compounds that modulate serotonin receptors and influence hormonal pathways, which explains its effectiveness for menopause-related pain, including hot flashes, joint pain, and the overall body aching that can accompany hormonal transition. Clinical trials have confirmed benefits for menopausal symptoms. Its anti-inflammatory and antispasmodic properties also support its traditional use for muscle, pain, and rheumatic conditions. How to use it at home. Black cohosh is most effective as a standardized extract. Look for products standardized to 2.5% triterpene glycol. For menstrual pain, take 20 milligrams twice daily, beginning 2 to 3 days before expected onset. For menopausal pain and symptoms, consistent daily use over at least 4 to 8 weeks shows the strongest results. Traditionally, the root was simmered as a decoction. 1 teaspoon of dried root simmered in 2 cups of water for 20 minutes, strained and drunk in small amounts. Safety note: not recommended during pregnancy. Avoid with hormone-sensitive conditions, estrogen-dependent cancers, unless cleared by a physician. Some cases of liver toxicity have been reported sourced from quality-certified suppliers and do not exceed recommended doses. The forest gave North American women their medicine long before pharmaceutical companies began patenting hormones. The roots are still in the ground, still offering what they always have. Number 18, peppermint mentha, Thymes piperita, the headache herb in your garden. It grows with abandon, spreading through every garden bed it touches, spilling out of containers, taking over wherever it is allowed. Most people pull it back, trim it, try to contain it, and most people completely forget that this aggressive, cheerful, fragrant plant is one of the most effective headache remedies in the natural world. Peppermint's medicine is menthol. This compound, when applied topically, activates cold-sensitive receptors in the skin and selectively inhibits pain pathways in effect, creating a cooling sensation that overrides pain signals. It also has genuine muscle relaxant and vasodilatory effects that address the underlying mechanisms of tension headache. A pivotal 1996 study published in the journal Cephalogia found that a 10% peppermint oil solution applied to the forehead was as effective as 1 mg of acetaminophen paracetamol for tension headache. Not more effective. As effective, and without any of the levetiracetam effects of regular acetaminophen use. This study has been replicated and expounded upon multiple times. The evidence is robust, and yet almost nobody knows it. Traditional use extended far beyond headaches. Peppermint tea was used for digestive pain, intestinal cramps, and nausea. Peppermint steam inhalation was used for sinus pressure and headache. Peppermint oil was applied to muscles for post-exercise, soreness, and stiffness. How to use it at home. For tension headache, dilute 2 to 3 drops of peppermint essential oil in 1 teaspoon of carrier oil and apply to the forehead, temples, and the back of the neck at the base of the skull. Keep away from eyes. Reapply as needed every 30 to 60 minutes. For digestive pain, steep 1 tablespoon of fresh peppermint leaves in boiling water for 5 to 7 minutes. Drink after meals. For sinus pressure, add 5 drops of peppermint essential oil to a bowl of steaming water. Place a towel over your head and inhale for 5 to 10 minutes. Safety note: keep peppermint essential oil away from the faces and chests of infants and young children. It can cause respiratory distress. Dilute before all topical applications. Peppermint tea may worsen acid reflux in some individuals. Every garden already has this medicine, growing untamed and generous, waiting for someone to remember what it was for. Number 19, wild lettuce lactuca virosa, nature's forgotten analgesic. This is the entry that may surprise you most. A plant so potent in its pain-relieving effects that 19th century physicians called it wild opium, not because it contains opioids, but because its effects for some types of pain can be comparably calming. Wild lettuce is a tall, spindly plant that grows along roadsides and disturbed ground across Europe and North America. It looks something like a very large, overgrown lettuce gone to seed, with spiny leaves and small yellow flowers. When you break a stem, A milky white sap called lacticarium flows out. This is where the medicine lives. Lacticarium contains lactocopacrin, lactocin, and related sesquiterpene. Research has demonstrated that these compounds bind to opioid receptors in the brain, the same receptors activated by morphine, though, with a much gentler, non-addictive effect. Studies published in Journal of Ethnopharmacology have confirmed analgesic and sedative effects, particularly for pain related to the nervous system, muscle tension, and anxiety. Traditional use in 19th century medicine was widespread. Lacticarium was sold in pharmacies as a sedative, and it was prescribed for chronic coughs, insomnia, and pain. When pharmaceutical opioids arrived, it fell out of favor, not because it stopped working, but because the new drugs were more dramatically potent and more profitable. How to use it at home? Wild lettuce tea. Harvest young leaves before the plant flowers. Dry them thoroughly and steep 1 teaspoon of dried herb in boiling water for 10 minutes. The taste is bitter and distinctive. Drink 1 cup in the evening for pain-related sleeplessness. Wild lettuce tincture is available from specialty herbal suppliers and may be more practical. Use with caution and start with a small dose to assess individual sensitivity. Safety note: exercise caution. Some individuals are more sensitive to its sedative effects than others. Do not combine with sedative medications, opioid pain relievers, or alcohol. Not recommended during pregnancy or for children. Harvest and identification should be done carefully. Consult a reliable botanical guide. The roadsides held this medicine all along. The physicians who knew about it were not forgotten. They were simply replaced. Number 20. Holy basil Tulsia sumum tenuiflorum, the sacred plant that heals everything. And here, at the end of our list, we come to the plant that may be the most complete, the most whole, the most generous of all. In India, the tulsi plant grows in the courtyard of nearly every home. It is considered sacred, a manifestation of the divine, a protector of the household, a plant whose very presence is believed to purify the air and the spirit. Hindu families water it every morning. They bring its leaves into prayer. They brew it into tea for every ailment, from fever to heartache to chronic pain. This is not superstition. This is the accumulated wisdom of at least 3,000 years of careful observation. Tulsi, holy basil, is classified as an meaning it helps the body adapt to and recover from stress of all kinds, including the physiological stress of chronic pain. It contains a rich matrix of compounds. Eugenol, which we met in cloves and which has documented analgesic and anti-inflammatory effects. Ursolic acid, a powerful rosmarinic acid, which reduces inflammatory and a suite of flavonoids and volatile oils that together modulate the stress response, reduce cortisol, and support the immune system's return to balance. Modern research has validated anti-inflammatory, adaptogenic, and neuroprotective effects. Tulsi reduces the perception of pain by calming the nervous system's state of chronic hyperactivation, the fight-or-flight overdrive that amplifies every pain signal. Clinical studies have shown improvements in joint pain, headaches, anxiety-related pain, and general pain scores in those taking Tulsi daily. How to use it at home. Fresh Tulsi tea is one of the most soothing drinks in the botanical world. Take 5 to 6 fresh Tulsi leaves or 1 to 2 teaspoons of dried herb and steep in boiling water for 5 to 10 minutes with a small piece of fresh ginger and a pinch of black pepper. Add honey and a squeeze of lemon. Drink 2 to 3 cups daily for chronic pain, stress-related pain, and general well-being. Tulsi is safe for daily, long-term use. In fact, its benefits increase with consistent use over time. Growing a Tulsi plant on a windowsill or in a garden provides both fresh medicine and the calming, aromatic presence that traditional cultures have honored for millennia. Safety note: generally very safe for most people. May mildly reduce blood sugar levels. Monitor if diabetic. Large amounts may theoretically have mild blood thinning effects. The safest and most effective use is as a daily tea in reasonable culinary amounts. 3,000 years of sacred tradition, now confirmed by modern pharmacology. The plant that Indian families have kept in their courtyards for generations was not there for decoration alone. It was there because it heals gently, persistently, completely. You have just heard the names of 20 plants, 20 teachers that have been growing quietly in meadows and forests and gardens and riverbeds, waiting with the patience that only plants possess, waiting for us to stop running and remember. Here is what I want you to take away from everything we have explored today. Pain is a signal. It is the body's most urgent language. It is asking for something, for rest, for healing, for a change, for attention. The instinct of modern medicine has been to silence that signal as quickly as possible, and there are certainly times when that is exactly what is needed. But there is another way, a way that has sustained humanity through every era of history before the pharmaceutical industry was born. A way that says, let us listen to the signal, and let us offer the body what it needs to heal, not just to stop hurting, but to truly, deeply recover. Nature has been offering this for as long as plants have grown on this earth. Long before laboratories, long before patents, long before orange bottles with child-resistant caps. The willow by the river, the lavender on the hillside, the ginger in the kitchen, the tulsi in the courtyard. They have not changed. They are still there. Still working. Still waiting. You do not need to abandon modern medicine. You do not need to choose between the old ways and the new. What you need, what we all need, is the knowledge to make informed choices. To know that when a tension headache begins, peppermint oil might be enough. To know that when your joints ache in winter, Boswellia and turmeric are worth trying. To know that the wild lettuce growing along the fence at the edge of your property has a history and a science behind it. Start small. Plant one herb. Make one tea. Reach for one salve before the pill bottle. Not in fear of modern medicine, but in trust of something older, something that has never stopped working. Nature is waiting for you. She always has been. If this video opened a door for you, if something here sparked a memory or planted a seed, then take a moment before you leave. Share it with someone who is tired of reaching for the bottle and ready to reach for the earth instead. Leave a comment and tell us which plant you are going to try first. We read every single one. And if you are new here, welcome home. This channel is dedicated to the old ways, the forgotten knowledge, the wisdom that our grandparents carried and our great-grandparents lived by. Subscribe and ring the notification bell. We post new content every week. Because the old ways are not gone. They are only waiting to be remembered. General disclaimer. The information in this video is for educational purposes only. It is not intended as medical advice and does not replace the guidance of a qualified healthcare provider. Always consult a professional before beginning any herbal protocol, particularly if you are pregnant, nursing, taking medications, or managing a medical condition. Learn to properly identify any plant before using it medicinally.